Hi everyone and welcome to my channel. It's Eleonora here from Dermacure, and today I would like to talk about plasma pen treatment. What is the plasma pen treatment? Who is the plasma pen suitable for? Who should not do the plasma pen treatment? Why you shouldn't do it? What are the contraindications? And really just to kind of crack on that topic, I am Eleonora. I'm the owner of Dermacure Clinic and also the educational director of Ray Cochrane Beauty and Aesthetics Academy. We are based in central London and we are one of the kind of most successful or one of the biggest training aesthetic academy in UK. This channel is all about education. I am also a trainer. I teach aesthetics, beauty, anything related to that topic, lasers, advanced treatments. So I teach on weekly basis. I teach a lot, so I have a lot of students and I love my job so much. I also am an aesthetic practitioner that I practice a lot, so I really want to help other people. I also have a lot of students from abroad, travel from different countries. Like it's really exciting. I have dedicated my life to my job and my work, and yeah, I do a lot of research, I read a lot, I learn and all of that. So thank you so much for joining, and if you're interested in that, please subscribe to my channel. Plasma pen treatment is non-invasive treatment that is quite advanced. It creates tiny channels on the skin, but without touching the skin. So the small device has a tip, that the tip is with the size of a needle, so super thin, and that device, and again that depends on the device, and that needle kind of go close to the skin and releases plasma, so small hue. That plasma kind of starts breaking down the protein, or does create little burns on the skin, just to be easy for you to understand, and that appears as a small tiny dots, yeah, so burnt dots. This is exactly what happens on the skin, but without touching the skin. So we only do that with plasma. That's why we have a lot of stimulation of collagen and elastin. So we create those holes on the skin, and we create that kind of trauma, but the holes are spread onto the skin in a very controlled way. So they're all symmetrically spread into the skin, so we can see the skin shrinks, and this is so like incredible because it just happens instant and it happens in front of our eyes. So when I do the treatment, I actually can see the skin shrinks, and of course when the skin shrinks, so the skin tightens up, so it lifts. It's super clever way of rejuvenating the skin, eliminating any fine lines, eventually wrinkles, tightens the skin. So it's just such an incredible and clever way, whoever has designed that kind of device, to help millions of people around the world to see and achieve that beautiful result. Of course, the treatment should be performed very correctly, because often I've seen bad reactions, bad outcome after the treatment, but this is nothing to do with the actual treatment. It's more likely to be connected to the device, that is probably fake or poor quality, cheap device that in many cases doesn't really use plasma. So we're talking about plasma, we're not talking about device that just burns the skin, because it's very different. We're talking about plasma. So many devices are just using that small tip that is quite hot, and it burns, that kind of like tiny metal a tip burns the skin, which is bad, and creates scarring, and it's really not the correct way of doing it. So that's why we are using true plasma. It has beautiful rejuvenation effect on the skin, can remove a lot of imperfections from the skin as well when done correctly. You have to make sure that you use also you do kind of have the treatment done by someone that is really experienced, like well trained, and uses one of correct devices. I would say one of correct devices. Usually if device is quite expensive, it's a good device. What can you treat with plasma device? So you can very successfully do a non-surgical blepharoplasty. So if you have a lot of kind of saggy skin around the eyes, both upper and lower eyelids, or like on the sides, absolutely you can do the treatment. It's good to do the treatment, and it's better option than surgical blepharoplasty. First of all, it's much cheaper than that, less pricey, and also give you great results in a very good way, because when we talk about blepharoplasty done by doctor, it's just like surgically done with the kind of local anesthesia. First of all, it's not very healthy, and also we just cut in the old skin and kind of like stitch again that kind of unrejuvenated skin together. Rather with the plasma, we rejuvenate the skin overall, which is, you know, much better way. Also, we can remove moles and skin tags very successfully with single session. Like, you don't actually have to come in 99% of the cases for a follow-up. So you, especially skin tags, they just go with one treatment, and yeah, you can see on the video how I'm actually doing that. You also can remove moles super successfully, incredible results without any scarring. If you remove the moles surgically, it's not good, because, you know, most of the times you can see the stitches, you can see the scarring, you can then after that the customers need to call for different treatments to actually deal with the scars, especially if it's on the face or, you know, somewhere visible. It's not the best idea. We can do, of course, general skin rejuvenation all over, so we can do full face if we want to. We can only treat the lower face, the upper face, the around the eyes, like whatever the actually areas with concerns are. We also can do treatment called xanthelasma. So that treatment is very it's a cholesterol that is built on the kind of corners of the eyes, like can be upper, like just somewhere here, or on the sides, or at the bottom of the eyes as well. So it's cholesterol, it's like fatty tissue that is built up there. It's usually you know, a result of taking some medications, or you have some underlying condition where, you know, it's resulting in that cholesterol to be built up there. And it's very successfully removed surgically and with plasma. I don't advise surgically again, because it's surgical, stitches, you know, cutting, local anesthesia. With the plasma, we just literally burn the cholesterol, like that fatty tissue down, and it's so successful. And I have another video where you can watch beautifully how that has totally transformed someone's skin. And, you know, this is an expensive treatment done surgically by doctor. It's few £1,000 treatment, rather with, you know, with the plasma, it's not even 1,000, which is so amazing. And, you know, sometimes you have to do second one, but most of the cases, one treatment is totally enough. So yeah, this is like mostly about what the device can treat, and any blemishes on the skin also can be treated with that. Also warts, that I also have a video that I removed warts from my daughter's finger, that really made her feel quite bad, especially at school. She's only 6, so, you know, it's literally successfully treated it, and I absolutely love the amazing results after it. So it's just literally no scarring, nothing. Her fingers are beautifully how to say, clean, like nothing, no even scarring, no scar tissue, no different texture of the skin, nothing, none of those ones. Who is the treatment not suitable for? So I would just say the treatment is pretty much suitable for everyone that doesn't have any, you know, kind of like medical history, any diseases, disorders that can actually prevent us doing the treatment. But main one, I'll just let you know what you have to be very much aware of. So we don't really treat people with diabetes. We have to be very careful because of the healing problems they have, unless they have doctor's note, and unless really you maybe we do patch tests, see how the skin heals, yeah, just to see before that if really the customer wants to do the treatment. Yes, there is an option around it, but we have to be super careful, and also very experienced with that. Also, we don't treat pregnant women, or if you're breastfeeding, we can't treat you as well. It's very important to be careful with that, because usually we have to be very cautious when we are dealing with pregnant women or breastfeeding, just nursing mothers. So keloid scarring as well, it will totally prevent us to do the treatment. So if you suffer keloid scarring or raised scars or hypertrophic scars, like, we cannot do the treatment for you, unfortunately, because again there is a risk of scarring on those areas where we have worked. So definitely no. So that's a contraindication. If you have healing problems or taken any medications that prevent your skin to heal correctly, properly, or like take much longer to heal, you might not heal very well as well after this type of treatment, because we need your skin to heal well in order to achieve best results. So we wouldn't take any risk if that's not the case. Also, if you suffer lupus, it's also autoimmune disease. We don't really want to treat anyone that has lupus, so yeah, it's important to be aware of that as well. We also don't treat dark skin types, so the treatment only is suitable for, unfortunately, skin type 1 to 4. Protocol wise it says 1 to 3, but yes, we can treat light skin type 4, which I've done, and it's great, absolutely great, but we need to make sure that they use some melanin suppressors, or like really something that kind of prevent or like affect the melanogenesis process. That means production of a pigment or skin color, because when we create some kind of trauma skin, of course we'll be taking that as a trauma that needs to be, the skin ability to protect first kicks off. So we need to make sure that we are absolutely careful with that, so we can give the customers melanin suppressor creams, like for example something with kojic acid or azelaic acid inside, something arbutin as well, something that kind of help with hyperpigmentation, so prevent this kind of forming of dark patches on the skin, or just hyperpigmentation. So this is about hyperpigmentation, and it's important to know that. So also when I said we don't really treat dark skin types, there is only one condition where we can treat. We can actually treat if you because with plasma pen we also can treat someone that has dermatosis papulosa nigra. So these are dark, slightly raised patches, usually happen to appear only on people with dark skin, like kind of dark phototypes, like skin type 5, like Afro-Caribbean skin type, so usually appears here on that area or here. It's absolutely fine. They are usually very safe and they can be removed easily with the plasma. So we need to be careful with them, because obviously customers with dark skin, they have also high risk of hypopigmentation. That means lighter. So when we remove those raised blemishes, we might see light skin underneath. So in those cases, I would advise you to do a patch test, see how the skin heals underneath. So basically that's it really for in terms of plasma. If you have any questions related to that video, you can put your comments in the section below and I'll get back to you. Also, if you're interested in more videos like that, please support my channel, give me thumbs up, and also subscribe to the channel, and then I'm going to create more content for you guys. I really hope you have a beautiful day, a wonderful week, and I'll see you in my next video. Thank you so much guys for watching. See you. Bye bye.